All right, parents, here we go again. It's the Ask Dr. Tony episode. This is the Experience Miracles podcast, and I'm your host, Dr. Tony Ebel, an expert in pediatrics, neurodevelopmental disorders, and drug-free, nervous system-focused healthcare. On this weekly episode, I'll be addressing the top questions on every parent's mind. If there's one thing we love and welcome, it's parents who never stop learning, asking the hard questions, and advocating for your kiddos like none other. So get ready for some real talk, real-life clinical and parenting experience, and real easy to understand answers that will help your family take action and get to that next level of health and healing. You ask, I answer. Let's dive into today's episode. Here's the question that came in today, and it's one we get all the time, and it's one I spent all weekend, just last weekend, down in Orlando at the most incredible healing conference for kids and families, the Documenting Hope Conference, and it's just amazing, that organization, Beth Lambert and everyone. And the question is, can chiropractic help a child fully heal without the use of functional medicine? Now, I'm going to set the table with this before I get into the answer. And I need everybody to hear these three very kind of introductory, interwoven points about this before I actually get into the answer. Number one, this is so fresh. It's just so cool that this question comes in again today, because all weekend down there at this incredible conference, and usually when I go speak, I spoke at Autism One conference, which was going strong for many years right in my backyard here in Chicago. I have spoken at California Jam. And by the way, if you attend other biomedical integrative health conferences with your favorite doctors, practitioners, and presenters, tell them about me. They need to know about what I'm going to answer here, because even in this advanced, incredible functional medicine, integrative medicine world that we now have access to, we now have awareness about, so often there is a very important foundational conversation, root cause conversation, or if we play out the seminar kind of agenda, there's a presentation missing to get parents the answer, the information, and the solutions that they really need to get full healing. So I want to speak to that. I want you to know that I just literally hallways after the seminar chats, I just got to talk to the top functional medicine doctors, integrated practitioners out there. And they, each of them, the top doctors who really understands how healing happens down there. And by the way, this is locally too with our incredible teams around here. They all agree with the answer I'm about to give you. Now, that doesn't mean that this explanation and this neuroscience I'm going to walk you through is very common knowledge right now in our healing communities, but it needs to be. So number one, if this whole thing, number two, listen, I want to kind of close number one by saying number two, please listen to this whole thing. I know if you're jumping on live as we go through this, maybe you can only get a soundbite. You've got to come back and listen to this in full on our platforms and on the podcast, because there's no way to answer this question effectively in a short order. There's a lot of details that matter here, because if I were to answer it in just a two-word answer to chiropractic, can chiropractic help a child fully heal without the use of functional medicine? My honest, scientific, clinically experienced answer would be, it depends. So there's the third layer of this I want to talk about, and that is it depends, because every practitioner you want on your team needs to be obsessed with individualized, personalized approach to their care. That is, if it's a neurologically focused chiropractor, they need to look at your kiddo, dot the I's, cross the T's. That's what we do. So this job, I always talk about it on the podcast, especially this part of it, the Ask Dr. Tony show. I love it, and it's also by far the hardest piece of content I can ever make, because I really love answering questions knee to knee, one-on-one, across the desk with parents whose child I've dug into their individual case history. Nobody dives into case histories like we do as PX Docs. Nobody, okay? Nobody dives that deep. And then we've done our exams and our scans. As I'm going to explain to you today, nobody looks deeper into root cause than neurologically focused chiropractors. We actually look deeper than functional medicine. And that'll make sense as a statement if you listen to this all the way through and you give me time to go into the science. And so it's hard to answer the question in a general landscape. And I know that if folks just take out a part of this and hear that as my answer, they'd go, oh, this is what he's saying. And in order to get what I'm really saying and what your family really needs, I need you to get all the way through this one. Okay, so that is my kind of precursors to this answer. Those are kind of the important variables that come into play as we have this conversation and this explanation. Another thing, getting into the answer, I really want to dissect the question. There's a lot of details that I actually want to tap into first before going into the science that answers it. Can chiropractic, let's pause on the word chiropractic. It can't be regular chiropractic. It can't be standard spinal chiropractic. This has to be the best of the best. If we're going to talk about full, optimal recovery and outcomes, I'll tell you this, you have to address the nervous system first and foundationally. That it will be my thesis statement answer to this question. In order to address the nervous system, the central and autonomic nervous system at its deepest layer of dysfunction and dysregulation, and therefore adjust with enough clinical excellence, care planning, and details to our clinical protocols, that has to be a nervous system focused pediatric and family chiropractor. That has to be a PX doctor. If you want to entertain this conversation, can chiropractic help? And then especially if we want to go with the best results we could possibly imagine, well, then it has to be the best chiropractor doing this work. They have to have advanced training. They have to have advanced experience. Their clinical protocols need to go deeper. So I would reword this question to say, can neurologically focused chiropractors, PX doctors, help a child fully heal? Now let's take that word, fully, okay? Fully is different for every single child. Now, the greatest chance for full, and this is why I love the Documenting Hope team and all the doctors and all the practitioners. By the way, the answer is going to be the best results for almost all kiddos is multiple practitioners working in a coordinated, sequential fashion. Now, sequential, you might think, well, yes, I definitely want all my kids and doctors and practitioners. I want a whole team helping my child heal, and I definitely want them communicating, which is a hard thing to get to happen, but it's important. That is just step one. The most important key to unlock healing for your child is to understand which practitioners, which approaches need to go first and foundationally, because healing doesn't happen with everything trying to fit into one space at one time. And that's what we wish could happen. That's what I see so often, so many practitioners doing with their clinics is, I'm bringing in everything. I'm going to be a chiropractor. I'm going to do neurofeedback. I'm going to do primitive reflexes. I'm going to do hyperbaric oxygen chamber. I'm going to do biomedical analysis. I'm going to do, the list goes on. And healing doesn't happen that way. And I've done a different episode about that. So if you need to know about the healing sequence and the healing order and the hierarchy, I'm going to hit it pretty hard here today. But if you want to know it in detail, you just send us a DM and we'll send you that direct episode to it. So to get full healing, we not only so often need a full complement of different practitioners and different interventions and care options, but it's not just important to have them all on the list. It's important to order them in the right batting order and hierarchy, okay? Now, let's talk about the word heal before we even go into. These are important. Before I give you the answer, I have to really define the question so that you get the accurate answer. The word heal, chiropractic doesn't do the healing. Chiropractic doesn't treat anything. Chiropractic doesn't cure anything. Dietary changes don't do the healing. Supplementation doesn't do the healing. Detoxification doesn't do the healing. Medication never does the healing. Your child's body, brain, nervous system, physiological system. There's a lot I could say to mean the same thing. Your child is designed and fully capable of healing. To what level? To what degree? To what amount? That's individual to each kiddo and the storm they've been through and the age they are and the level of dysfunction and disrepair that's happening in their body. And we only know that answer. We can only give a more accurate prognostic answer individually. But since I can't give you individual answers on this platform, I'm just going to net it out to every parent the way that I feel God has called me to. We expect miracles. That's why we wear the t-shirt. We experience miracles. Well, actually, I'm wearing a different one today in honor of our Miss Harper, our special needs kiddo, who we just had incredible changes, incredible life extension, incredible quality of life improvements through this kind of care, and is now up in heaven singing and dancing and jamming Miss Harper and Caden and all that. So I'm not wearing my Expect Miracles t-shirt, but we do expect them. I wear it the majority of the time because of that. So I need you to know that the healing happens from your child. I need you to know that your kid is the hero. I need you to know that you are the heroes. I need you to know that you are the difference makers. You are the catalyst. Our job is easy compared to that internal innate healing that your child will go through. Our job is easy compared to yours as a parent who needs to find this information, access this information, get the practitioners on your team, line up the ducks in the right order, which is really the essence of this conversation. So can a child fully heal? I expected it for my son, Oliver, when they told us he had a 20% chance of living to age 1 and a 99.9% chance of having autism and epilepsy and cerebral palsy and having severe brain-based disabilities for his entire life. They said 99.9 to just not sound harsh, because who says 100%? They don't say that out loud, but they meant it. So that was their expectations, that he would do no healing. So I met that with a 180 on the other side and had 100% expectations that he would fully heal, and he did. So I set that in motion for families as often as I can. Back half, detailed part of this question, without the use of functional medicine. Now, I don't exactly know, because I haven't been able to, talk with this parent one-on-one as to the question comment, and maybe kind of ask a question within the question to kind of get some details as to why they would ask it in this way. But I wonder if it's this. It's overwhelming when your child is struggling, and it's overwhelming when you look at all the options to get them better. It takes a lot of mental, emotional bandwidth from you as a parent. It takes a lot of time to reach out and coordinate and set up and attend all these appointments. And it costs a lot of money to get your child to heal as well. So one thing you will always, and I hope if you've listened to even a second of our content, you will always know that this is just truth from the beginning to the middle to the end. We're in it with you. I've seen my kiddos go through healing crises and journeys. I have been in practice, and the way we practice is our doctor-patient relationship is truly like a family. Like, we just go to a level that most don't. And so we just understand, and we empathize with, and we bring into the conversation all of the realities, scientifically, logistically, and everything else. So I got to imagine that this question is either coming from, goodness gracious, there's only so much we can do, or goodness gracious, we've tried maybe functional medicine already and not seen the results. And so would chiropractic be different? Would chiropractic do it on its own? Would chiropractic need to happen in tandem, in combination with functional medicine? And as I've covered on a few other episodes, and now I'm going to get rolling into the full answer scientifically, that is the current practice environment we are in. When I began practice, 80% of my patients were medicated. Now today, 80%, it's actually a little bit north of that, of our patients coming in have already spent months, if not years, working with biomedical functional medicine. My last two patients, when they sent in the supplements and the homeopathic remedies and all the different, what we would call functional med things that they are taking and giving to their child, and have had these doctors and practitioners recommend, they had to attach a PDF. One of them was 3.5 pages long, and another was 2 pages long with all the functional medicine interventions and supplements that they are doing. Now, there's some science to this reality right there that I experience in practice. There's some sharing that needs to be said, which would foster this question. They're doing all those things, which are awesome, and they're not medication, and they're definitely getting further into the root cause. Because when I look at the supplement, I can give you the best analogy with this, the last one, and the question, the way we ask it in our paperwork, it says, please list all the medication, supplementation, homeopathic, functional medicine interventions. Please list everything you're doing. That's the far left column. Please list exactly, what it is, its brand name or detailed name and dosage. And then in the far right column, it asks the question, reason for, like, what is this designed to do? And it really caught my eye, and it's just great timing for this podcast here, is to say support. And I read it, and it goes, this one supports the gut. This one supports the microbiome. This one supports the nervous system. This one supports the endocrine system. This one supports the thyroid. This one supports inflammation. This one supports. And when I read that, I looked at it very similar to what I've seen through my whole career, where instead of a medication being on the line in the middle, it was supplementation being on the line in the middle. And so it wasn't that there's a medication for this symptom or condition, but there was a supplementation or a natural intervention for this condition. Now, I love that. So this is why I asked at the beginning of this to listen all the way through, because I knew I'd get to this part. And if people take this out of context, they're like, so is that good? Is that bad? It's great. It's so much better than Strattera, Ritalin, Vyvanse, Depakote, Topamax, phenobarbital, Keppra, right? I'd much rather see all these supplements and homeopathic and natural interventions on there. But I want to teach you this. I want to say there's still something missing. I want to say what you already know in your gut, mom and dad, that there's something foundationally missing. And no, it's not medicine anymore, traditional, conventional pharmaceutical medicine, where you're chasing every symptom or every condition with a medication. But are we now chasing systems with supplements and homeopathics and herbs and so forth? So I know I'm only verbal here with this, and I can't, sometimes on YouTube, I wish I could do this with every video. I wish I had a whiteboard and some of my handouts and my posters to show you. It's a little harder on these platforms, and I love that. That's fine. So you just have to kind of imagine me drawing and straightening this out. So I want to teach you, to give you the answer to this question, I want to teach you the sickness flowchart, okay? That's what I'm going to call it today. So there's a 3-step flowchart that creates chronic illness, all right? Now, on the far right side, the effect of this that we're going to go through. So step 3, so we're going to go through it in reverse. The third thing on our flowchart is all the symptoms. Now, when you put a bunch of symptoms kind of together into a box, they get a condition, they get a diagnosis. This third box, listing out all the symptoms and giving it a diagnosis and saying it's this condition, that's the business of medicine. That is their expertise, right? Listing out all the supplements and saying, okay, well, this is this condition. Here's your medication to take it, all right? Now, middle box. Middle box is what we're going to call the systems. Systems, plural. So what do we know about autism? It's a multi-systems challenge within the body. What do we know about all illness, all chronic disease? It's a multi-systems problem, okay? And so the middle box is going to say, hey, is the gut and the microbiome working well? Probably not. Is the endocrine system, the thyroid, the pituitary, the adrenals, are they working optimally? Probably not. Is the immune system, is our inflammatory regulation and our immune function working well? Probably not, right? Is the motor system, the gross motor system, the fine motor system, the sensory motor system, are those systems working well? Probably not. I'll leave it at that. Those are the 4 main horsemen, okay, to health. So the brain is dependent upon gut function, immune function, motor function, and sensory. And I'm going to give it 5, endocrine and then sensory. Okay. I'm going to pull sensory and it comes from those 4 into the brain, but I'm going to put sensory in its own box with those for now. So the middle box, step 3, symptoms, effects, conditions. The way of health care, sickness care, med care in the past was, here's your symptoms, here's your diagnosis, here's your condition, here's your medication. Now, what functional medicine, integrated medicine awesomely does, it says, well, those symptoms are related to dysfunction within this system, most likely. That's a microbiome problem. That's a gut health problem. That's an immune system problem. That's an endocrine system problem. That's a motor problem, right? Well, there's not a lot of supplementation for the neuromotor system. There's no medication or supplementation per se for the sensory system, which is where we're going to arrive to get you the answer you really need before we're done. So that middle box is, this is a multi-systems challenge. So we need to address multi-systems. So what functional medicine awesomely does, and I was trained in this. I went fully down the road for years studying biomedical. I did labs out of our office. We did stools out of our office. We did hair analysis out of our office. Like, I've looked at hundreds, if not thousands of these and taken hundreds of hours of training, okay? Not in a long time. I have not advanced with this incredible profession in this incredible place, but I know enough to be valuable to the conversation. And so we look at these multiple systems through labs, through stools, and we say, okay, well, this thing over here, this chemistry finding, and that's what it is. Labs, blood work is not looking at neurological function. I'm a little cart before the horse. I was going to say that later, but you can't evaluate the nervous system through chemistry because the nervous system uses chemistry, neurotransmitters, endocrine system, so forth, zinc, magnesium, serotonin, dopamine, pick one. For this analogy, the nervous system foundationally operates through the neuromotor and the neurosensory system. And that's how it most communicates with the organs and then uses chemistry. So we really don't get a root cause of exam of nervous system dysfunction through blood work, through stool, through hair. You can't use chemistry to find the deepest layers of neurology. It's not how God designed us. And all we need to do is go through an anatomy textbook, go through a neurophysiology textbook, and we know that the nervous system is a system all to itself, all in and of itself, okay? And it doesn't show up on labs. Secondary components of neurological dysfunction, neurological imbalances, toxicities being too high, deficiencies in magnesium or zinc or whatever it may be, those are, I'm going to call it this way, those are physiological symptoms. I'm going to call them that just for contrast. Those are physiological, secondarily symptomatic expressions of abnormal neurological function. The nervous system is in box 1. So if we finish our flowchart, step 3 is symptoms, conditions. Box 2 is all the different systems, microbiome, immune system, and everything that may be dysregulated. If we look at that system individually, it's not working well. So instead of, this is where we need to round third base and close this. So if that system's offline in autism, the gut and microbiome, if the endocrine system, the immune system, the motor system, the sensory system, if all the systems, if your child has a multi-systems condition, which is autism and pandas and autoimmune and you name it, they're all multi-systems once a child gets into chronic illness. It's not one thing, it's a multitude of things. Then it begs this question, which gets us our answer. Is there one system in the body that controls, coordinates, modulates all of them? I've never done a presentation to parents or other providers without showing this slide that has this quote on it. And it says, from Dr. Bruce Lipton, pioneer of epigenetics and probably the world's, he teaches at New Zealand Chiropractic College, but he was at Stanford and Wisconsin Medical School before that, when he found this in his lab in his research, what I'm about to teach you, he left medicine and went into chiropractic because he knows that the foundational first full step in healing must begin with the nervous system. And he says the quote like this: the function of the nervous system is to perceive the environment and coordinate the behavior of all other cells. Now, I know I'm just saying that to you verbally, so I'm going to run it through one more time. The function of the nervous system is to coordinate the behavior, so the function, of all other cells. Put cells together, those are called systems, okay? Put a certain like-minded cells all together, like design cells all together, that's the gut and the microbiome. Another set of cells is the immune system. Another set of cells is the motor system. Another set of cells is the endocrine system. So what systems function controls the function and the coordination and the integration of every other system in the body? The nervous system. So that takes me to my last 5 minutes of this one here. And the answer is, it depends. So let's go back to the question. Let's say you're tuning in late. Can chiropractic, I'm going to reframe it to the details we hit before. Can neurologically focused chiropractic help a child fully heal without the use of functional medicine? And the answer is, it depends. And then I'm going to add to that answer here as we round third base with this one and say, often that's exactly what we see happen. And in many cases, we don't. Let me give you the last 5 minutes as to what that could be. So, root cause flowchart. Number 1, the foundation of illness, the foundation of sickness, the foundation of dysfunction is within the central and autonomic nervous system. That's not where functional medicine can get to. That's not where conventional medicine can get to. That's not the deepest layer of root cause that anybody can get to other than chiropractic. That's just the way this sorts out. The second layer, the root. So think of it. I always use this analogy too. So the roots of a tree, and if you actually think about like what a root looks like, just right now, get an image in your head of what roots look like, and they kind of go all over, and they have all these little nerve ending looking like findings, right? And they are the sensory receptors into the soil. So you may have heard the tree analogy and go before, well, what if the soil is toxic? Exactly. How many of you have already cleaned up toxins entirely from your child's life and they haven't healed yet? Okay? How many of you moved to a farm to have better soil that you grow your own food in? How many of you are fully organic and you cook fermented foods all day, every single day? How many of you only shop at Whole Foods and only give your child whole food organic supplements? How many of you, so if we stick to the soil analogy, how many of you already have changed the soil for your family, but the nervous system healing hasn't happened yet? So now let's leave the soil. Let's go to the roots. The roots are the nervous system. The roots are the sensory, autonomic, and the vagus nerve. That's the roots. The roots then go into the trunk. The trunk is the gut. The trunk is the immune system. And so when we say that the real root cause of autism is in the gut, we're close, but it's kind of like horseshoes. We ain't there yet. The gut is governed, modulated, and really coordinated first by the nervous system and then communicates back to the nervous system. Is it a two-way street? Yes, it is. But is there a more foundational direction from nervous system to gut function than there is from gut function to nervous system function? Yes. And so the second layer of root cause is multi-systems approach. That's where we love and work in tandem and coordination and integration and sequence with functional medical providers forever and always will. Because many kids, these toxins have gotten in and they're stuck. They're stuck in the microbiome. They're stuck in the liver, and they're stuck in the body. But not every supplement, not every binder, not every detox agent, not every chelation, not every cell core product, not every, you choose your option to do this, is strong enough. Actually, that's not what I want to say. Not every detox agent can get deep enough into the physical biomechanics, neurobiomechanics of the body to get things moving. The majority of our patients foundationally are subluxated. Their nervous system from a neurophysical foundational component is locked into sympathetic dominance, fight or flight, and then it shuts down the gut, and then it causes immune system dysregulation. And so when we're working on the gut and we're working on the immune system, dang, we're getting close. Dang, we're doing better than traditional medicine. But for so many kids, we're not getting all the way down there. So what are the two possibilities? There's two possible outcomes for this approach. Number one, many kids with chiropractic alone do get better. As God always directs timing, I had planned to have this conversation on the podcast here today. And on our communication channels of the practice, there's a kiddo, a 4-year-old child who was completely locked into level 3 autism, nonverbal, sensory meltdowns, stimming, all the things. And we actually happened to be the first place that this family started. And here's the summation of the answer, okay, these last 2 minutes. We were the first place that this family started with care. And what they thought they needed to do was to immediately, along with starting him getting adjusted, foundational nervous system, they wanted to go deep down the functional med roads. They wanted to detox. They wanted to add supplements and homeopathics. What other therapies should we be doing? And who would blame them for wanting to throw the book at their child who's nonverbal and struggling and developmentally delayed? And because we know this science, we've been asked this question. And most importantly, I'd say this in closing. We've asked ourselves this question for 17 years, and nobody has studied it more. Honestly, nobody's had a clinic who's done all this, both myself and then in tandem with other providers. And so what we told this family is what we want to tell yours. Let's give the foundational nervous system dysfunction the time all by itself it needs to heal fully and see how far down the road we can get. And it took 90 to 100 days. This kiddo's on their 4th month of care. And now we're seeing massive, what we call momentum and launch point, where the nervous system is calmer and regulated and development is catching up and speech is exploding and these things are happening. And the only thing we've done is chiropractic. So according to this kid's current trajectory, we are very confident and hopeful that this kiddo will go through and fully heal with chiropractic alone. But in the same breath, not every kiddo goes like that. There's many cases where we get to these launch points. We do 90 days, 3 months, 6 months of chiropractic care on its own. And now what we've done is we've reached what we call neurological stability. We've reached much more functionality and regulation within the nervous system. And we can measure this on our insight scans. And we see so many neurosoft signs. The kid's sleeping better. The kid is pooping better. The kid's sensory system is better. The kid's motor system is better. But we know from their case history that they had an injury. They had a reaction. They had a toxic exposure. We know from that kid's case history that more needs to be done. So some kids, yes, heal all the way fully with chiropractic alone. And many don't. And many, we then need to add on physical therapy. We need to add on occupational therapy. We need to add on speech therapy. We need to add on functional medicine and turn it over to the absolute experts we have in our community. And many are online now that we can work with in tandem as well. And they can complete, I think of it in closing like this. It's a relay race, but there has to be a leadoff hitter. There has to be a leadoff runner. There has to be a foundational table set first, because not everybody can run. Not everybody can have the baton at the same time. And that's hard as a practitioner because you want to get that kid better yesterday. That's hard as a parent because you want to see your kiddo come out of the storm yesterday. And so what we love is working truly, pun intended, in an integrated fashion with functional integrated practitioners. I'll never not do that. But the most important thing, and I hope you really were able to see it through this episode right here, is which one first? Because if we go in the wrong order, we definitely won't achieve full optimal recovery and healing. We might not achieve as much. We might not achieve any. And honestly, well, overtime tip here, sometimes when we go in the wrong order, and there's a lot of detoxification, and there's a lot of work on primitive reflexes and brain-based stuff, if we go if those healing endeavors come out guns a-blazing for your child, a lot of functional, a lot of detox, a lot of brain-based stuff, and it goes real fast, real heavy, real early before anybody has adjusted that child and taken care of their foundational neurological dysfunction, sometimes it makes it worse, right? And I'd be remiss to tell you that that clinical truth isn't there. Nothing matters more than the batting order. Nothing matters more than doing this in sequence and in the right order. So how do you know? How do you know for your child? Start with the foundation first. It's going to be the hardest thing. And if you need me to send you this episode every day to get through it, because trust me, Aaron and my other homies out there, I love these questions. Keep them coming. It takes at least 3 to 6 months of foundational work all by itself. Less is actually more in the beginning, not more is more. And that's what happened with the kiddo that we routinely, each and every single visit, probably 35, 40 different conversations of, hey, we're going to add those things if we need them. We're going to add those things when we need them. They're absolutely wonderful, but we just need to get his nervous system to a better place first. Number one, see how far he can go with that alone. And number two, if we run into a roadblock, we'll know exactly what it is, why it is, and then we'll call, we'll integrate, we'll make a referral to functional med, we'll do this, we'll work in tandem. We do that all the time. Do I have a number of how many heal with chiropractic on its own and how many heal in conjunction and collaboration with movement-based therapies and functional medicine and detoxification? I don't have a number, but I hope to one day put this into research because I know that for many kids, they need it all in the right order. And for other kids, they really need chiropractic. Thank you for tuning in to today's episode. Do you have a question that you would like to submit? Either send it to support@pxdocs.com with the subject Ask Dr. Tony, or head on over to our socials @pxdocs where you can submit your question in our stories every single week. Every kid counts and every family counts, so let's leave no questions left unanswered. If you loved this episode and you want to help us reach more kids, we would so appreciate if you left a review and a rating on your favorite platform. God bless, be well. We'll see you on the next one.